All communities have the potential of being self-healing communities. And that's what I'm here to talk to you about today. How do we support communities in becoming self-healing communities? And by that, I mean a place where people are able to prevent the transmission of adversity from one generation to the next, and they're able to stop the progression of adversity that tends to complicate lives and make it more difficult to parent, to work productively, and to live meaningful lives. In all of these communities, we see better and better outcomes, better and better results every generation. When we have a partner as a strong community, when we have a state capacity building partner, a partner in the state government that helps us to build the kinds of strengths that we need in order to become self-healing, then what happens is every community can produce stunning results. For a relatively small investment, we see big changes in the way communities operate and in the way they continuously improve life for everyone that lives there. When I was much younger, I served as an elected county commissioner in one of the counties in my state, Washington State. And when I first started being a county commissioner, I had a good friend who was in charge of United Way at that time, and she and I decided we needed to understand more about the lives of young people in our community. And so we conducted a survey. And really the focus of the survey was to find out what one thing, if you had it in your life, do you feel would make a huge difference for you? And so we thought of that survey, what's the one thing survey? And when the results came back, I have to tell you, I was shocked because the one thing that over 85% of the young people said they really needed and would make a huge difference in their lives if they had it was at least one adult they could talk to about their lives. One adult they could talk to. Now, at the time, I was shocked. I couldn't imagine 85% of the young people in my community not having someone that they could talk with, but that was in fact what they told us. And then I started thinking about how does that come to be? And how can I, as an elected official, partner with the state to make sure that we make a change over time in that reality? So I started talking to state officials and looking for grants and all of the things that you do when you can see that you have a population that's really struggling. And over, I was told by state officials, well, Laura, we can't provide you with extra grant money because your people are too hard to serve. Too hard to serve. No, they're not too hard to serve. They're ready for the next step. It's just the next step isn't the same thing that you, the state official, are thinking about. And so I decided over time that I would leave local service, which I'd been in for many, many years, and begin to work for the state. And I wanted the state to be a different kind of partner. I wanted the state to be a partner with communities to help people that were affected by adversity and to engage those people in continuously improving the way the service system works. And I wanted big change. I'm an impatient person. I don't really have much patience for small incremental change. So I wanted to figure out how does the state be a kind of partner that helps with transformational change. And I set on this journey and I began to staff a governor's cabinet level council called the Family Policy Council. And that council had as members 10 elected and appointed officials. It had the governor, the elected superintendent of public instruction. It had 4 legislators, one from each of the caucuses, and it had all of the cabinet members that worked with children and families in our state. So I worked for a council that was both executive branch and legislative branch officials in our state. And my job was to be a liaison, a sort of translator between communities that were building the capacity to improve results for families and children, a liaison between communities and these 10 elected and appointed officials. Now, at that time, we were a state that was in trouble in terms of our young people. We had experienced dramatic increases in juvenile crime, And you can see here the chart in that period of time between 83 and 94, we had this steep upward trend in juvenile crime. And that was one of the motivations that our legislature and our governor had for making a change in the way we partnered with local communities. We had awareness that violence doesn't happen all on its own, right? It's an escalating trend that is linked with other experiences. And so our legislature and governor agreed on a new law that would challenge communities to reduce the rates of 7 major social problems: child abuse and neglect, family violence, youth suicide, teen substance abuse, teen pregnancy and malparentage, and dropping out of school. And we recognized in that law that we couldn't possibly reduce the rates of all of those 7 major social problems without community partners and without families as partners. In fact, in our day-to-day lives as human beings, we're the ones generating these rates. And so we've got to shift the way our day-to-day lives are operating in order to reduce these rates. We formed a system in our state that had 42 community networks. These were collaborative groups that were formally authorized by the state as special purpose districts. And we had a small staff team, and our staff team was the liaison between this council of 10 elected and appointed officials and 42 community networks, 10 of which were tribal networks. We had urban networks, we had suburban networks, we had rural networks, and we had frontier networks. And the work that we did in building the capacities of communities wasn't different in those places. We as a state still offered a core set of challenges, incentives, and also rewards for success. So around in the early part of my tenure with the Family Policy Council, I got a chance to go overseas. My daughter, Vida, lives in Austria, and I was going to go for winter holidays, one of those chance in a lifetime trips. And we were planning that trip. My daughter was so excited that I was coming, and I was equally excited to be spending the holidays with her. And she was sharing with a teacher friend. She teaches English in an international school there. She was sharing with a teacher friend named Lydia that I was coming. And Lydia said, well, your mom can't come to Austria and to Europe without spending some days at my parents' house. Let's find out if she'll come for Christmas Eve, Christmas, and the day after Christmas. And so we decided we would. And Lydia's parents live in southern Italy. So we flew in to Bari, way down in the heel of the boot in southern Italy. We flew in the morning time, and Lydia and both of her parents came to pick us up, which was kind of a sacrifice because, in fact, Italian in southern Italy, they don't do so much morning. They do afternoon, evening, and all through the night. But they came and got us, and on the drive home, they were telling us how excited they were that this was the perfect time for us to be coming for a holiday because aunties and uncles would be there, and children and their new spouses, and boyfriends and girlfriends, and extended family. And the first grandchild, 15-month-old Ariana. And when they said her name, Ariana, their arms flew up every single time. Even the driver of the car, as he was talking about his new granddaughter, he said, Ariana will be there. And we drove up to the house and we got out of the car, and Vida and I both thought, well, we would go get luggage. But no, everyone went straight into the living room and onto the floor to play with Ariana. And that's how we were introduced to this family. And we would wake up in the morning and they would give us a cup of a coffee, a little espresso, and a biscotti. And then they would sweep us into a car to get tours of this magnificent area where they lived, just like we would if we had people, guests in our home in the Northwest or in Wyoming or really probably anywhere in the country. And they would put us in a car, and while we were gone, the rest of the family would be cooking. And they would be cooking all day for the evening meal. And by the way, the evening meal in southern Italy lasts 6 to 9 hours. And we would come back in the afternoon after having enjoyed that tour, and we would come back to a living room all set up with a long, long dining table all ready for the evening meal. And we would offer to help, but no, we were guests, so they didn't want us to help. They wanted us to relax and enjoy our time there. And so we would sit with Ariana and play with her. And at one point in the first evening we were there, little Ariana started doing this movement of 1 foot up and then 1 foot up and then 1 foot up. And her uncle peered around the corner of the wall from the kitchen and said, "Everyone, Ariana wants to dance." And they ran out of the kitchen, moved the tables to the side, and stood in a circle around little Ariana, just doing the same thing she did, mirroring her movements, 1 foot up and 1 foot up, all laughing and smiling and enjoying the dance. Until little Ariana, 15 months old, she at one point put 1 foot up too high and she fell onto her bum, and her grandpa slid across the floor, picked her up, put her head against his heart, and began to rock. Now, this is not a grandpa that knows all of the neurobiology of the importance of rocking to soothe the amygdala in the brain. No, this is a grandpa who does this because it's what you do. And as these days went by, we began to see this pattern of what you do is cherishing this young spirit and feeding her ability to be fully present with her family and eventually, as she gets older, with her community. In one of the evening meals, Vida, my daughter, and I were sitting together at the meal, and it was getting later into the evening, and it got to be 10 o'clock, and Vida and I both know a lot about child development. We adore children, and so we started leaning into each other saying, "Ariana must need to go to bed pretty soon, don't you think?" "Oh, yes, I'm pretty sure she needs to go to bed pretty soon." It got to be 10:30, 10:45. Ariana probably needs to go to bed. She started getting a little bit grumpy around just close to 11 p.m. And we thought, okay, well, this will be the time. You know, we think we know about how children are always nurtured in life. But her uncle, the same uncle that had peered around the wall, ended up standing up about 11 p.m. and said, "Everyone, Ariana needs more pasta." And he ran into the kitchen and he got a huge platter of pasta and put it down in front of Ariana at her high chair. And Ariana happily began to eat her pasta and got happy, happy, happy again and stayed present for the festivities for a while longer until her mama picked her up and laid her head against her heart and began to rock her. And Ariana fell asleep with all of us in the holiday festivities, with all of us still joined with us in that celebration, but in her sleeping moments. So as we talk about adversity in childhood, you know, what we really want, right, is to hold in our hearts that kind of quality in relationship. I'm not suggesting we all become Italian because that won't really work as a solution, but we can hold little Ariana in our hearts as we think about how do we build the capacity of families? How do we build the capacity of communities to be better and better at, at nurturing children, at growing children who can be their fullest potential throughout their lives. So what we learned in working in Washington was that four things really mattered the most in terms of building community capacity. First, the ability to focus on the root causes of problems, to clearly see, like the focus of a camera lens, to clearly see what's driving the status quo and what might need to change in order for us to deliver something quite different. The second thing is learning, systemic organizational learning, so that we're innovating, we're trying new things, and we're learning what works for whom and in what context. Certainly in Wyoming, where most of the communities are frontier and people live far apart, we won't find the same programs and strategies are effective in Wyoming as we might find in a large city someplace else in the country. And so we want organizations that are trying evidence-based practice, but then are improving on the results from those in Wyoming through innovation and learning communities. The third is making decisions based on the results we actually want for future generations, the results we want for our families, for our grandchildren, for our great-grandchildren. And oftentimes, the kinds of decisions that are being made in communities are based on what's popular or what we can get money for, or how we secure jobs. All of those things are important. We can have all of those things and still be making decisions based on the results that we actually want to produce. And the fourth factor, the fourth kind of capacity that we needed to build with communities was an expansion of leadership. Now, we have positional leaders in every community, but the kind of leadership we're talking about is in addition to positional leaders. We want everyone who wants to help to have an opportunity to contribute, to be helping to co-lead a new way of being together that actually reduces the rates of major social problems. So we found 4 factors that mattered, and we intentionally worked with communities to build those capacities, to focus on root causes, to have systematic learning about what works for whom and in what context, to make decisions based on the results we want, and to expand leadership to include everyone that wants to help. And when I'm talking about focus, one of the major things that we learned about early on in our tenure was the Adverse Childhood Experience Study. And I know in the last of the Governor's Mental Health Summits, you had an opportunity to hear Dr. Rob Anda, the co-principal investigator of the ACE study, talk about ACEs. As we learned more about adverse childhood experience, we understood the importance of focusing efforts to interrupt the progression of adversity that often leads to transmission of ACEs from one generation to the next. So if we understand what drives the status quo, if we understand the drivers of major problems like youth suicide, like youth violence, etc., then we can interrupt those drivers. So this diagram here is a diagram that shows the population attributable risk, or the risk that is attributable to adverse childhood experience. So the gray area in the center is the proportion of each of these items around the outside of the wheel, the proportion that is attributable to ACEs. So 67% of suicide attempts attributable to adverse childhood experience, 62% of intimate partner violence, 61% of adult incarceration. And you can read around this wheel to see that ACEs are driving very large percentage of both health and safety problems and also workforce and productivity kinds of challenges in people's lives. And when epidemiologists use this population attributable risk to calculate the power of a disease agent, in this case, the power of ACEs in driving problems in the population, they think of it this way. They think, what is the percentage of, for example, suicide attempts that would be gone if we were able to eliminate adverse childhood experience? 67%. 67% of suicide attempts, 62% of intimate partner violence would be prevented if we were successful preventing adverse childhood experience, and on and on. And what is remarkable about this science is that because all of these have a common origin, when we reduce that origin, when we reduce the prevalence of adverse childhood experience, we will reduce the rates of all of these problems at once. And we began to educate communities about the importance of adverse childhood experiences and about how adversity can progress from childhood into adulthood and lead to these kinds of very serious problems for the community. When we're working with communities, we're working with living systems. We're working in the same manner that we would if we were working with pasture management or management of any living system. And in living systems, one powerful factor for how they are, the way they are, is called feedback. So this is a very simple feedback diagram that's relevant to our conversation today about self-healing communities, in that childhood adversity leads to biologic adaptation. Our brains and bodies are actually changed. We adapt to our experience during childhood, and then we go out into the world, our adapted, our changed self, and society responds to us. And that societal response can make adversity better, or it can make adversity worse. So this feedback matters, whether it's a vicious cycle that's making adversity worse generation after generation, or if it's a virtuous cycle that's making adversity lower and life more flourishing generation by generation. And we know that parents have the most power for preventing adverse childhood experience. How are we supporting parents? How are we as a society in our response to young people that are becoming parents and to young parents with new children? How are we supporting them to make sure adversity rates are coming down and down and down each generation? So one thing we have to think about as we're making strategic changes to the way that communities are operating is that adverse childhood experience tends to lead to adverse peer experience, adverse school experience, and that tends to lead to adverse adult experience. And it's this pileup of ACEs, the childhood experience, plus peer and adult experience that leads to the transmission of ACEs from one generation to the next. And so we not only need to think about preventing ACEs, but we also need to think about preventing adverse peer experiences like bullying and preventing adverse adult experiences. That is, we think of preventing the progression of adversity that so often leads then to risk for the next generation. So these are the two areas we really have encouraged communities to focus on as they're building the capacity for being self-healing communities. Are we preventing the intergenerational transmission of ACEs from the parenting generation to the child generation? And are we stopping that progression of adversity across the life course that can create so many challenges for families and communities? I want to give you a couple of examples of how communities produce just stunning ideas. In fact, we found that as we taught about this science and taught about the importance of these four factors, focus, learning, leadership, and results-based decision-making, as we taught about them, communities generated stunning ideas and they generated very impressive outcomes. In fact, communities are the heroes of this story. And I'm sure that you'll find that in Wyoming as well as you move forward. So the first example I want to give you is a new way of using policing. It was invented by three small cities in Washington state. And as the officials there learned about how adverse childhood experiences affect young people in their lives, they realized that oftentimes we see young what would it be, 12, 13, and 14-year-olds committing a first nonviolent crime, which is actually them acting out the difficulties that they're having in their childhoods. And so they started thinking about what if we had a two-generation approach to working with families where children have been arrested for a first nonviolent offense. And they invented the Juvenile Intervention Services Program. So they authorized the police officers when they had evidence to make a first arrest of, usually it would be a 12-year-old, of a nonviolent crime. Those officers, instead of making the arrest, had the option of going to the household and talking to the adults that live in the household where that child resides. And they would offer the adults, we could go ahead and make this arrest. Here's what we found your child doing. And oftentimes that's petty theft, that sort of thing. And or we could offer you this contract. And what the contract says is that you as a family will go for a family assessment within 72 hours and that you agree to follow up on any recommendations that that assessment comes up with for 6 months. If you follow through on that as a family, there will be no arrest, there will be no prosecution, your child would not have a record. And what happened astonished all of us because we sort of assumed that families that had deep troubles just wouldn't sign the contract. But we were wrong, actually. Almost every family that was offered this contract signed the contract. They followed through, they had assessments, and very significant problems were found in those assessments. Intimate partner violence, older sibling violence in the home, substance use problems, mental health problems. And those families did follow through, most of them for longer than 6 months. And what we found was that the rates of reoffense among that group of young people who had had that juvenile intervention service plummeted. And it dropped so low, almost no reoffenses occurred, that I went to our legislature to a hearing to announce the results of this and make recommendations that other cities try it, and that the legislature make an explicit endorsement of this way of using police officers. And the committee that I spoke to said, "We don't believe you, Laura. That can't be because our best outcomes are coming from diversion. You can't possibly have a program that would be better than diversion." And what I was showing them were 10 times better than the rates of recidivism for young people that had gone through diversion. So I had to say, okay, I'll bring back the mayors, I'll bring that back the police chiefs, I'll bring back the people that are in charge of the assessment, and we'll talk to you again next week. And we did that. And from there, our legislature became obviously very enthusiastic about this new way of thinking about two-generation programming. Now, the second focus, the second kind of capacity we want to build in communities is learning. And in order for organizations to learn and manage and improve the strategies they're using to help families and children, we have to have good data. We have to have trend over time data on many factors, and we have to develop useful and credible indicators, data that is credible to local people so that when they see rates going up or rates going down, it has meaning for them, right? And it will motivate results-based decision making. We want to support iterative learning and learning communities so that there's an opportunity for communities to generate better and better results and to be rewarded for that. And we want to have opportunity for communities to share their findings. Like, we tried this innovation program that we invented. We didn't know how it would work, but it's actually 10 times more effective than our current strategies. That's important for other communities to hear. And so when we're building the capacity of communities and community organizations to learn, the state partner is essential in providing data in formats that are useful to communities, in sharing and creating venues for that sharing from community to community and across organizations, and for spreading the news and providing incentives and rewards for improving results among families and children. So when we think about that, I wanted to give you an example. It's a recent example in a community in another state. This is a state, a large state in the United States. And in the county where this program was invented, they have the highest youth suicide rate in their state. And they just simply didn't have enough mental health professionals to be addressing the depth and breadth and despair and grief associated with having such a high youth suicide rate. And so they started thinking about how could we try some new things, and then we'll put in place this learning system where we're continuously evaluating whether what we're doing is working or whether it's not working for the people we care about. And they invented a brief intervention system where they use professionals and volunteers. They train them in brief intervention techniques, much like you would train a 1-800 crisis line volunteers. And then they put out a local crisis number, much the same as what Wyoming has done, to develop a localized response to people who are experiencing crisis or who are concerned about someone. And they spread the word. If you're concerned about someone who you believe might have serious suicidal thoughts or is considering suicide, you can call this number, and we have brief intervention specialists who will reach out to that person and talk with them about what's happening in their lives. So that was the first step. And what they learned was people were happy to call that line, and the young people who were seriously considering suicide were happy to have support from a brief intervention specialist. And then they started saying, yes, but what will give that spark of hope? What will give that spark in their lives? And they decided that they would collect information from people about, from appreciative inquiry kinds of interviewing. And they would ask, what is it that gives you energy in your life? What is it, if you could do it in your everyday life, would make you feel a little bit more energy for your life? And they started hearing from kids and from teens about skateboarding, about riding horses. They started hearing about reading books. They started hearing about a whole host of interests that this young people just didn't feel like they could figure out how to access. Plus, they were experiencing depression, so it's hard then to create that for oneself. So they coach these brief intervention specialists to be collecting that information, and then they started recruiting people in the community. You own horses. We have young people who are experiencing such deep despair, but it's riding a horse that would make a difference for them. And so they started pairing these young people with natural resources in the community that those young people would care about. And so they started connecting kids to their own gifts, to their own love of life, right? And what they've learned is that these young people are building skills that are valuable in the community, and they're building hope and plans for their future. This is an example where continuous learning led to a whole new way of working with young people who are experiencing suicidal ideation and who the community was so concerned about. So I've talked to you about 4 capacities that the state can help communities build, and the third one of those is results-based decision making. So I'll just give you a very brief example of results-based decision making that happened because one of our juvenile courts, it was actually one of our large juvenile courts, was noticing that they had a steep increase in females committing felony crime. And these were young girls that came back into the juvenile court with multiple felony offenses. And this was new. This pattern was new in the juvenile court. And so they paid one of our network coordinators to do a gender study to learn more about what's the pattern, what might be happening with these young women. And what they found was that the young women were committing another felony in order that they could come back in and be served by the court because they needed health care. And the juvenile court administrator was like, oh, there's much better ways to get health care. And so the juvenile court administrator came to the legislature and asked for a waiver for a small percentage of the dollars used by the court so that the court could partner with a local health provider, and they could be establishing this relationship between females served by the court, actually males and females, but at the time the focus was on the females served by the court that could experience good health care out in the community, in the clinic in the community, so there could be a warm handoff when the youth was done doing time. They already had a medical provider that would continue to deliver service to them. So the idea was that we aren't so concerned that every dollar be spent exactly in the way that we planned in terms of programming. What we're concerned about is that every dollar be spent to produce the outcomes that we want. In this case, to produce lower rates of felony crime. And we were able to achieve that with this small innovation. Now, in one community, one of our very rural communities, I saw an extraordinary example of leadership expansion. I'm going to tell you a short version of this story. There is a longer version, so at some point that would be fun to tell you. But in the interest of time, we had in this community, it's a farmland community. They grow onions, they grow potatoes and other dryland crops. And in this community, they had the highest youth violence rate in the state at the time when we started our partnership with between the state and community networks. And at that time, this small rural community was really struggling. And there was a person in that community who was working in a clerical position at the time who witnessed a violent crime and who decided through the trauma of witnessing that violent crime between two young teens that she just couldn't look the other way anymore. She had to find a way to make a difference in her community. And she started talking to people, and through a series of serendipitous events, ended up coordinating the work for the network. And I went on site because at some point I was watching the data from my office in the state capitol. And in this county, the juvenile crime, felony crime rates had gone up and up and up, quarter after quarter, year after year for over a decade. And all of a sudden, I'm looking at the monthly crime reports coming through the courts, and I see that violence is down in this county. And I call to my colleagues, violence is down. And they can't believe it. I can't believe it. I pick up the phone and I ask for permission to go on site and shadow, just follow and learn what they're doing that could be making a difference with crime in this community. And I arrived on site and I got into the car of the coordinator and she took me to the onion packing plant and she asked the manager, could I talk to everyone in the onion packing plant? If I talk to everyone, maybe I'll get some ideas about what would make a difference for young people. And so the onion packing plant manager said, fine. And we walked onto the floor of this onion packing plant and she began to talk with people. Now, she'd lived in this rural community her whole life, so she knew these people working in the plant. She was able to say, Mary, don't you have a second grader? I have this job of helping us to create safe community living, and I don't know how to do it. I'm just gathering ideas. How would you keep second graders safe? And she would write down Mary's idea, and she would go to the next person. Juan, don't you have a fifth grader? Don't you have a third grader? How would you keep fifth graders and third graders safe? And she would write down Juan's ideas. And person by person, we walked all the way through the onion packing plant, writing down idea after idea. Here's what I might do to keep our kids safe. And we got out of the car and we went to the French fry processing plant next, and then we went to a bank. We went to a small restaurant, and she talked to everyone everywhere we went. And she was so modest. I have this job. I don't know how to do it. I'm going to need your help. And she wrote down idea after idea, and we went at the close of that day. I went to my hotel room. She went home, and I went to sleep. She stayed up. And she was looking on the internet. Are there programs that exist that have already been developed that look like these ideas of our local people? And we went to her board the next day, and she said to the board members, I've got 3 ideas that really match pretty well to these programs that have already been developed. Could I have your permission to write grants to raise money to put these programs in place in our community? And of course, her board voted yes. She had permission. And this very talented coordinator, who claimed she didn't know how to do her job, began to raise money, and over the course of the next 5 years brought in $1.3 million in programming to this small rural farm town community. And why? Because when you're a grant reader and you read that this person's talked to every second grader parent in the county and they agree that this is the next step to keep kids safe, you win that grant because it's so unusual to have consulted with all of the residents. And we started to see youth violence plummet in this community. But the most remarkable part of her work was she would get a small grant to put a program into place, and she would go back to the onion packing plant and she would say, Mary, remember when you told me that we could do this? I won a grant. We're going to be able to do it. But I don't know how to do it. It was your idea, so you have to lead. And Mary would be like, no, I can't lead that. I have to work. And she'd say, oh, no, I already talked to the manager. He's willing to give you some flex time so you can lead, because we all want safe community living for our children and for ourselves. And so Mary would sort of be cornered, right? It was her idea. She would help to lead. And she would be an advisor, or she would spark the next spark of ideas that would come from improving on that idea in the community. Now, this is one way of expanding leadership. I know in a lot of models for building community capacity, we think of people sitting around a table and coming to agreement, but that's not always the way it happens. Sometimes it happens this way, where we go out in the community and we're gathering ideas and we're noticing who wants to help. And then we're recruiting them into leadership roles. They can be very small leadership roles by sending cookies to a meeting, or they could be very large leadership roles like running for office. It doesn't matter. It's that everyone who wants to help can provide leadership in the community. So what we found was the communities that built these four capacities and used them well began to have a rhythm of engagement. In fact, these four capacities are kinds of work that if we do them in this order, focus, learning, results, leadership, they produce a virtuous cycle, and the community's results get better and better over time. And that's what we want. For self-healing communities, we want to put a feedback loop in place that helps communities continuously learn and improve. So we want to recruit everyone who wants to help. We want to understand the origins and drivers of the problems that we want to solve. We want innovation and system learning, and we want to incentivize bold and unusual moves, and then reward learning what works for whom. And we want to make decisions based on the results that we really want, even if it means the state needs to provide more flexibility, or the state needs to perhaps negotiate with the federal government to provide more flexibility so we can really focus on those results that we want. Now, Wyoming data really illuminates an escalating wave of challenges. And I want to show you a little bit about that because it's very similar to the youth violence trend lines that we were seeing in Washington at the beginning of this partnership, this family community state partnership. When I looked at your data, I was looking at the Pregnancy Risk Assessment Monitoring System, which is the system that collects information from moms after they've had their child. I looked at the Wyoming Prevention Needs Assessment Survey, which is a youth survey that focuses a lot on substance use prevention. I looked at the Wyoming Behavioral Risk Factor Surveillance System, or BRFIS, which is the adult health surveillance system that's a partnership with the CDC. And I looked at the National Survey of Children's Health. And I was working on understanding the picture, understanding what is the landscape in which we will build self-healing communities across Wyoming. So let me just remind you that stress chemicals during childhood actually are sculpting the development of the brain, and that affects the development of the body and the developmental trajectory of children throughout their lives. Stress chemicals change the instruction for self-functioning, and that's why adverse childhood experience, or some of the reasons that adverse childhood experience have such a powerful effect. And we know that ACEs are the common origin for many problems. And then when ACE scores are elevated in the population, we're going to see higher rates of these problems in that population. That's because all of them have this common, a large percentage of each of them have their origins in adverse childhood experience. So I was particularly looking at these kinds of challenges in the population and looking for data that would give us clues. Now, the first thing I noted was that adults in Wyoming are reporting higher ACE scores than adults in other parts of the country. In 2020, Wyoming surveyed adults about adverse childhood experiences. And just as a reminder, these are the 10 ACEs that were included in the ACE study: 3 kinds of abuse, 2 kinds of neglect, and 5 kinds of household dysfunction that create stress for kids. And from your own behavioral risk factor surveillance system, we see that about 19% of adults in Wyoming reported having an ACE score, meaning the number of each of these 10 items of 4 or more. So they had experienced 4 or more different categories of adversity. And we compare that with a survey that was done, analysis, that was done by the CDC of 25 states, some of them are neighboring states to Wyoming, where 15% of the population reported having an ACE score of 4 or more. So Wyoming 19%, 25 states 15%, we expect to see then in Wyoming higher rates of all those ACE attributable challenges. And your BRFIS director explained in an email to me as he was releasing this data is that the consistent findings were the lowest rates for older adults and the highest rates of adverse childhood experience for the youngest adults suggests that ACEs may be increasing over time, that we may be experiencing in Wyoming that intergenerational transmission where each subsequent generation has higher ACEs than the previous ones. This is not unusual. This is occurring in many states in the country, but it is significant. It means that we have failed to prevent the transmission of ACEs from one generation to the next. And when we look at the National Survey of Children's Health, it confirms that difficulty that your BRFIS director saw. In this case, data was collected from parents about just the 5 adverse childhood experiences that are about household dysfunction that creates stress for children. And Wyoming ranked 10th worst in the nation for the percentage of children that experience 3 or more of these household dysfunction adversities. And because ACEs are so interrelated, experiencing 3 or more of these household dysfunction adversities probably means that many children are also experiencing abuse or neglect or both in their households. So this confirms what we see in the young adult population, that children have high risk in Wyoming, and they have high risk for many challenges throughout their lives. It also means that they will benefit tremendously from support now in their lives as children, but also as they age into adulthood, they will benefit tremendously from help as young parents. We know that accumulation of major stressors in the home, ACEs, can become compounded by stressors outside the home, including bullying. So I wanted to look at your data about bullying, and here's what we see in the trends in Wyoming. This is 6th graders reporting, self-report, that they've been bullied several times or very often in the last year. And you see this increasing trend line between 2006 and 2020. And we know from neurobiological research that bullying increases risk for depression, anxiety, anger, hostility, suicide, substance abuse, accidents, injury, and difficulty with learning. So we see ACEs leading to these challenges and bullying making that risk higher for young people. When we look at safety at school, this is just from a single year, 2020, we see about 1 in 5 young people experiencing lack of safety in school. When we have higher ACE prevalence, which we do in Wyoming, we also have higher rates of teen pregnancy. This diagram is from the Adverse Childhood Experience study itself. It is a slide from Dr. Anda. And what he found was that 42% of teen pregnancy in the population is attributable to adverse childhood experience. And you can see ACE scores along the bottom from 0 to 7 or 8, and the height of the bars is the percent of young people that experienced adolescent pregnancy. We see that as ACE scores go up, the risk for adolescent pregnancy also goes up. So we would anticipate that there might be higher rates of teen pregnancy, but we also have to recognize that during pregnancy, stress matters for the development of that young baby. Capacity for parents to prevent ACEs can be lowered because the parents themselves have behavioral health challenges due to no fault of their own, right? ACEs lead to these kinds of challenges, and if they had lots of adversity when they were growing up, they're carrying that risk into adulthood. Capacity for parents to prevent ACEs is also lowered when there's difficulty with parent and infant bonding, which can happen also when parents don't have adequate support as they're just getting to know their new infant. And the capacity of parents to prevent ACEs is lowered when young new parents are highly stressed before pregnancy, during pregnancy, and just after pregnancy. That stress creates the biologic stress response, higher cortisol, higher adrenaline, and all of the difficulties associated with that chemical response, the stress response. So I looked at your PRAM data, your pregnancy risk assessment data, looking at which of these parents of new infants, right? This is a survey where questions are asked just after an infant is born. Which group of parents experience 6 or more different kinds of major stressors during their pregnancy? And what we see here are age groups along the bottom, under 20, 20 to 24, 25 to 35, and over 35. And the height of the bars is the percentage of those new parents that experience 6 or more stressors during pregnancy. And you can see that the highest rate of stressors is among those parents that are under 20, and still a very high percentage, 10%, of the people that were 24 or under also experienced 6 or more major stressors when they were pregnant. This affects infant bonding and maternal depression and more. And so I looked at your maternal depression trends in Wyoming and found this upward trend very consistently over time from 2016 to 2020. Depression can interrupt parent-infant bonding, and that can change the chemical production and uptake of two chemicals that are incredibly important for well-being. One is dopamine. Dopamine allows us to anticipate pleasure. And so it's critical in preventing substance use disorders, for example. And then the second chemical, oxytocin. Oxytocin is the chemical that allows us to have preference for a particular relationship. And new mothers and new fathers' bodies respond to infant cues by producing more dopamine and oxytocin, so we can anticipate pleasure with that particular new infant, and that can really be important for attachment and belonging, for bonding with that new infant. But depression can interrupt that important function and can contribute to intergenerational transmission of adversity for the infant. So then I looked at your youth survey data with these question in my mind: are today's youth problems worse than they were a decade ago in 2012? We're going to look at trend data from middle and high school youth. And I want you to remember that we've just looked at the fact that new parents ages under 20 and ages 20 to 24 were the group of people that were experiencing 6 or more major adversities during pregnancy. And when we look at trend over time data, we are looking in part in years where those young people would have answered the youth surveys. And so we can kind of see the history of their responses in that trend data. So we're looking across time at self-report data. And as I'm going to show you some charts and graphs, but first let me tell you what I found. There's an escalating wave of behavioral health challenges. If it continues to be uninterrupted, it's going to drive public health costs for decades. It may drive public health costs for generations. To reduce public costs, we have to reduce the adversity during childhood, during pregnancy, and during infants' lives. About 1 in 4 10th grade youth report being so depressed all or most of the time that nothing could cheer them up in 2020. And that means that as we carry that depression into parenting, into young adulthood, that depression can create challenges in marriage, family, friendship, faith, and in work. Um, and we see worsening trends in mental health indicators that started long before COVID. These are not just COVID trends. These are trends that have been coming for a long time in Wyoming, and we shouldn't be surprised to see the challenges we see today. These are trend lines. This is depression, youth depression, for different grade levels. So the dotted lines are the older teens, 10th and 12th graders. The dashed lines are the younger kids, 6th and 8th graders. It's not important that you see every number here, just that all the trend lines are trending up for depression from 2012 to 2020. And when we disaggregate by gender, we see that the depression trends among girls started higher and are increasing more steeply than boys, although all of this depression is alarming and should be addressed. I wanted to look and see whether the depression trends were significantly different during COVID. And so I took the 2012, 14, and 16 data and created a projected trend line. And then I compared that trend line, which is the dotted lines here for girls and boys, um, with the actual. And you can see here that the actual trends aren't significantly different during COVID. Than we would anticipate based on the trend lines in those earlier years. This is nervousness. Again, we see the dotted lines 6th and 12th grade, the dashed lines 8th and 10th. Kids reporting feeling nervous all or most of the time. Upward trend lines for 8th, 10th, and 12th graders. And again, higher rates for girls than boys. This is worthlessness, alarming increases in trends, especially in 8th, 10th, and 12th graders, and significant increases, especially for girls, with feeling worthless. Suicidal ideation, this won't surprise you because you are gathering in part because of the tragedy of suicide in Wyoming, but especially among 10th and 12th graders, this increasing trend of suicidal ideation among middle and high schoolers. When we disaggregate girls from boys, we see this upward trend line, especially with girls, where we see 1 in 4 girls in 2020 reporting that they've seriously considered suicide in the last year. And this is attempted suicide also, upward trend lines in all 4 grade levels. I especially was concerned here because you see this upward trend even in 6th grade with these young people saying they've attempted suicide in the past year. And we see in this, we went from less than 10% of girls and about 6.5% of boys saying they had attempted suicide in the last year in 2012 to almost 16% of girls saying they had attempted and 8.5% of boys. Interestingly, we see reductions in drug and alcohol convictions in both felony and misdemeanor charges. And so that's the good news. Whatever we're doing to try to prevent drug alcohol as a way to cope with these difficulties with behavioral health, good job with your substance abuse prevention efforts in Wyoming. And then I wanted to compare the court filings for children in need of special services with the youth truancy self-reports of young people. And we see this small upward rise in both youth reports and in the court filings for truancy, not the kind of dramatic increases that we see in the behavioral health challenges. So I want to remind you about this focus. Are we preventing the intergenerational transmission of ACEs? We aren't yet, but we can. And communities can have the power to produce that prevention. And are we stopping the progression of adversity? Certainly we're not stopping bullying, we're not stopping the intergenerational challenges around depression, et cetera. But perhaps we're making a difference with substance use in this next generation. Those should be the focus of community efforts in Wyoming. When we focus there, we can produce stunning results. Because ACEs are not destiny. You know, people affected by adverse childhood experience are stepping into leadership roles, and they can produce stunning results in their own communities and their own spheres of influence. We know that because we've seen it work. Communities that are using these self-healing processes and partnerships and principles that I've talked about today improve the rates of major social problems. They reduced public cost in real time for entitlement programs. They generated lower than expected ACE scores in youth aging into adulthood, and they produced long-term savings for both public and private sectors. I'll show you briefly before I close some of the results from the work in Washington that we had from our partnership between the governor's cabinet and legislature and these 42 communities. So the 42 communities that produce better community capacity, we were measuring those four things: focus, learning, results-based decision making, and leadership expansion. Those are the blue bars here, and the red bars are the communities that didn't score high, that were not as effective at building those capacities. And we see less serious mental illness, less people struggling with the symptoms of mental illness, and lower depression in the communities using these self-healing communities processes. The green lines in this series of graphs I'm going to show you are the communities that were using the self-healing communities model and that built those capacities that I talked about today. And we see a reduction in child suicides at the same time where we saw an increase in other parts of the state, a reduction in juvenile arrests for violent crime, a reduction in juvenile alcohol arrests crossing the state line, and drug arrests reduction at a steeper, more positive trend than the rest of the state. We saw child out of home placements go up in both kinds of communities, but they went up less steeply in communities using the self-healing communities processes. We saw births to teen moms come down dramatically, both in large communities and in small. We saw dropping out of high school plummet, and this is just two ways of measuring the same thing. Regardless of how you measure it, we saw these rates come down, and they came down fairly quickly. In fact, in some of the communities where I've done consulting since I left state service in Washington, we've seen the rates of dropping out of school come down in 5 to 6 years. And we saw better educational attainment and employment. The blue bars here, or the dark green bars, are the communities that scored the highest on those four factors using our index. And you see here a higher percentage of people completing post-high school education and a higher percentage of people in those self-healing communities who were employed. These two graphs, probably the most important ones I can show you. Along the bottom are age groups, and the youngest age group is on the right on each of these two graphs. The age group from 18 to 34, those are the people that would have been affected by over a decade of self-healing communities work. And on the left, you can see that in all the other age groups, the green lines are self-healing communities. Our high capacity communities is another way we might talk about it. We saw about the same ACE scores in all those other age groups, but in the youngest age group, that's the age that would have been affected by our self-healing communities processes. We saw a lower percentage of people aging into adulthood with 3 or more ACEs. And on the right, the same pattern, a lower percentage of young adults aging into adulthood with 6 or more, with an ACE score of 6 or more. We saw dramatic public cost avoidance. We only looked at entitlement programs, and we saw with an investment of about $4 million a year, because this is not buying services. This is money to help make the existing service system more effective and more innovative and to be more locally tailored to produce better results on the ground in communities. We saw a $56 million biennial cost avoidance. That's in real time, plus a long-term cost avoidance. For every dollar invested, a $37 return on investment. So with state capacity building partner, what I know is that communities are the heroes. They actually can produce stunning results. And we just have the role of being the kind of partner, a new kind of partner that can help each community achieve that success. And with that, I want to thank you and say how much I appreciate and respect the work you're doing in Wyoming. It is impressive, and I have no doubt that the pathway that you're on will produce these reductions in the trends of all of these issues that you care about and have come together today to address.